Today we're talking about universal primary care. What is it and how could it affect our healthcare system?
Healthcare costs in America is by and large a bipartisan issue.
Meaning all sides of the political spectrum pretty much agree that healthcare costs are out of control. Now, what to do about that issue is where the disagreement is. First, credit where credit is due. I'm going to be referencing some stuff from Dr. Deborah Richter, who's been doing studies on universal primary care in Vermont.
For the past decade, Vermont has been toying with the idea of implementing universal healthcare for its residents.
But because there is so much back and forth on this issue, not a lot of progress has been made. And in the meantime, healthcare costs continue to rise.
In an effort to alleviate some of the pressure on the strained healthcare system, advocates from both sides have been starting to talk about a meet-in-the-middle solution called universal primary care. I want you to envision our healthcare system as a funnel. There are obviously exceptions to this, but just stick with me. In order to prevent somebody from falling down the funnel, you start with prevention. This is not only being able to see a doctor at the first sign of sickness, but it is also mental health care. It is healthcare education.
When we can't stop the issue up here, a patient will continue down the funnel to specialists, diagnostics, and maybe even end up in the ER or the hospital.
What's important to note is that care gets more expensive the further down the funnel you get.
Currently, the only piece of our healthcare system that is universal, and I'll define that in a second, is our emergency care, which also happens to be our most expensive care.
Now, if you're wondering how is it universal if I pay thousands of dollars to go to the ER? All that I mean by that is that the ER is the only place that you can go that won't require payment up front.
The ER is protected by the Emergency Medical Treatment and Labor Act, and what that says is that a patient cannot be denied care in an ER simply because they cannot pay.
What that also means is that patients who are denied primary care because they can't afford it often end up here. I think this goes without saying, but patients who can't afford primary care are likely not going to be able to afford emergency care either. To mitigate that, there are programs like charity care and government reimbursement to hospitals to offset this cost. Now let's get to the important stuff. This protection has to stay. It should always be there. There should never be a situation where a patient is denied emergency medical care simply because they cannot pay. The concept of universal primary care argues that if we eliminate the cost barrier up here, then less patients will end up down here.
Meaning if we invested more of our tax dollars into health education, disease prevention, and primary care, we would spend less of our tax dollars on ER and hospital care
and potentially have a healthier population.
So, pretty simple idea. Tell me what you think.